Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. I'm going to be speaking with Dr. Jasmin Makar. She's a pediatrician with Stanford Children's Health, joining us on the program to talk about ways that kids can stay safe as they go back to school and the importance of seasonal vaccines and year-round wellness checks. Welcome to Health Professional Radio, Dr. Makar. Thank you for joining us.
Thank you for having me.
You are a pediatrician there at Stanford Children's Health. Give us a little bit about yourself, and then let's talk about RSV a bit.
Okay. Well, I work at a practice in San Francisco, and I've been taking care of kids for 21 years now. RSV has plagued us for all 21 of my years. It is a very virulent virus that causes lots of cold symptoms in kids and babies, and often leads to kind of more severe symptoms than your typical cold, like say from rhinovirus or what have you.
What does RSV stand for, and is it found in adults?
So it stands for Respiratory Syncytial virus, and yes, people of all ages can get RSV. Most adults, had it as children, so may get a cold, may get some mild symptoms related to RSV, but tend not to get the more severe symptoms that babies and toddlers can get. With babies and toddlers, it can get into their lower airways. So instead of causing, just kind of a little bit of runny nose and a mild cough, it can get into the lower airways and cause more significant illness, including difficulty breathing, respiratory distress, and can lead to pneumonia.
Now, you said you've been dealing with this your entire professional career. What would you say the percentage of children are that are going to get RSV?
Oh, that's a hard one to answer, because some kids may be, asymptomatic or mildly symptomatic, and we don't test those kids that just, display only mild symptoms. So we're only testing kids who are, coming to us with more significant symptoms and may need to be, hospitalized, and that's really for kind of infection control purposes, right? To know whether or not they have RSV, so we can cohort them, in the same area of hospital, that kind of thing. Being
so prevalent, is it very easily diagnosed, or are there instances where it's RSV but diagnosed as something less severe?
Well, again, it's one of those things that because it can have a wide kind of spectrum of disease intensity, we're not always testing for it, and it can be, cause mild symptoms that could be the same as any kind of other typical kind of cold virus. So, and it can, when it does get into the lower airways of babies and toddlers, we call it bronchiolitis. And there are other causes of viral bronchiolitis. So RSV is not the only one.
So what's the normal course of treatment for RSV?
That's a good question. And like a lot of other viruses, there is no one treatment for RSV. There's no one specific treatment. So it's really supportive care of the symptoms. So the RSV tends to cause a lot of nasal secretions, kind of more than your typical cold. So dealing with those nasal secretions, suctioning them out, using nasal saline, a vaporizer, those kind of things can be helpful. And really it's time. That's really it.
Does it show up more in the fall, in the winter, or can it be seen during the summer and spring months as well among kids?
So it's typically more of a winter virus, but it has, and who knows exactly why, but this year it has reared its ugly head for us in the summertime. So it's usually kind of more of a November to March kind of virus, but there have been a lot of cases around the country this summer and a lot of hospitalizations related to RSV this summer.
Health practitioners being concerned about the COVID-19 pandemic and the flu, is this something that should also be looked at when you're taking a child to the doctor to maybe get a COVID test, or the vaccine when they become available for kids under 12? Is that something that we should be on the lookout for the remainder of this season and on into next spring and summer?
Yeah, it's definitely always on our differential, right? It's one of those viruses that we consider, and there are kind of point of care tests for RSV. So if you are you're concerned about it and you think it might be a cause, it's something that you can test for in many offices and certainly the hospital.
How is the COVID-19 pandemic, the vaccine, and the flu complicating RSV awareness and diagnosis?
Well, I think the hard part is that because the symptoms of COVID, especially the Delta variant, the symptoms in kids can be very minimal and they can mimic your typical cold symptoms. So all of these, the symptoms are overlapping between COVID, RSV, your standard cold viruses. And so that's what gets tricky. And so when kids come down with a simple runny nose and cough, we have to consider all of those as possible etiologies. And really, for infection control purposes, we want to rule out COVID kind of, first thing, right? Because we don't want to send a child back into school with COVID. So that's, it just makes it all that much harder. What do they do with a child who's sick and seems like they have a mild type virus, but we just don't know for sure until we test.
Now, obviously, the kids don't have a say as far as going back to school or mandates or anything like that. How do our kids stay safe at school while the adults go back and forth with them being in school or not?
Yeah, really good question. Getting vaccinated is the best way to prevent COVID-19. So making sure that anybody who's eligible that's around, your kids is vaccinated is going to be, number one way to protect, your child. Masking is super important, especially in a school setting where there's lots of kids in a smaller space indoors. So indoor masking really important and very possible for kids. Kids come through my office every day, as young as 2 and, wearing their masks beautifully, keeping them on, covering their nose and mouth. So it definitely can be done. Sometimes it needs a little bit of encouragement and practice beforehand. It's important to find a mask that fits your child's face well, so it's not constantly falling down and then having to touch it. At this stage with Delta surging in a lot of the country, I would recommend something more than just your average cloth mask. A KF94 or a KN95, which are kind of one step down from our N95s. That would be my preference. And then, absolutely kind of layering masking with all the other measures that schools have taken over the past, year, distancing, cohorting, improved ventilation, lots of hand washing. Those are all important measures, but they need to be layered, and vaccine first and mask, second. Those are the biggest ones, the biggest measures that are going to protect our kids.
And I guess, routinely checking to, see how your child is doing as far as the sniffles and any other symptoms that might go overlooked in the chaos.
Right. And I think that's what's the hardest burden for parents is that, any little symptom kind of has to be taken a little bit more seriously and, and it's going to cause some disruption for families. And that's unfortunate.
Well, Jasmin, do you have a website where our listeners can go and get some more tips about RSV, the symptoms, awareness, and some of these tips on keeping our kids safe at school?
Yeah. The American Academy of Pediatrics has a great website called healthychildren.org. And on that website, you can find all kinds of information, related to COVID-19 and RSV, but other tips on, keeping your children healthy, and hand washing and mask wearing and all kinds of tips. So I recommend that website for all of my family.
Well, I appreciate you joining us here on Health Professional Radio. Thank you so much.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Jasmin Makar. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.